name themselves. Okay, so hi everyone. I hope that everyone has renamed yourself. I am Jameng Palmo and I'll be the moderator for today. And I'm from Bhutan and I'm also the core member for Me For Myself. Now, before we begin with today's actual session, I would like to give a short introduction on Me For Myself and then Ram will take you through today's session. So first of all, Me For Myself, which stands for short M4M, it is a youth initiative campaign to promote mental health and well-being. And it was actually launched during COVID-19 pandemic, July 2020. And then it mainly focuses on age group 12 to 29 of Asia Pacific region, and it is to bring positivity and productivity, and it also provides a learning platform for youths, also a safe platform, and then it also brings opportunities with leadership activities and skillful involvement. And Me For Myself, it is supported by YPR Asia Pacific Center, Bangkok. Now, these are some of the programs that Me For Myself does, such as the volunteer program, M4M Ambassador Program, M4M E-Course, and M4M Monthly Series, and also M4M Global Competitions. And we also help in connecting the audience with like helplines and resources where they could get actual help from. And we also do advocacy and share about mental health in collaboration with other INGOs and NGOs. And for this session is one of the programs that M4M does. So this is a monthly series, and this month for July, we have our topic that is on minority mental health, and this will be done by Ram now. So now Ram will take you through. Ram, the platform's yours.
Let me share the screen. Jamie, is my screen is visible?
Yes, Ram, it's visible.
Hi everyone. So I'm Ram Dulip. I'm also one of the co-member of Me For Myself campaign, and also a co-member of YPR Asia Pacific. So as we this month dedicated to minority mental health, so we are running the session today based on the same topic. So I can see that we have new individuals here. So before we go ahead, does anyone has any idea about what is minority means and what is the minority mental health? You can if you're unable to speak, you can chat in the box. You can send your responses in the chat box. All right. So understand the minority mental health. So minority means does anyone has any idea about what is minority? So what like who falls under minority like communities and etc. etc. Yeah, so minority mental when it comes to minority groups, so it can be people with disabilities and people refugees and as always we say LGBTIQ community and what else? So we can take also immigrants when it comes to minority groups and so these are the people who falls under the minority categories. So they also go through severe mental health issues, and that's why this month has been dedicated to the specific underrepresented individuals. So when it comes to understanding minority mental health, its minority mental health refers to the unique struggles and challenges that underrepresented groups face in regard to mental health and well-being. So I gave you examples who falls under minority groups like disabled community, refugees, immigrants, LGBTQ people, and etc. So they are falling under the minority mental health. So they also go through the severe mental health, and it can be like different reasons. So they also face like mental health problems. So moving forward, so these are some common statistics, but I will share the statistics from the Asia Pacific region. Yeah, so these are the statistics of minority mental health in the Asian Pacific regions, in our region. So the first one, you can see mental health disorder affect approximately 20% of the population in Asia Pacific region. So basically, this is based according to the World Health Organizations, 20% of entire population in the South Asia Pacific region are facing mental health issues. And less than 10% of individuals with mental health condition receives adequate treatment. That is also according to the Lancet Psychiatry in 2022. And if we take India, so India has a very big population, and from them, the 56 million people suffer from depression and 38 million from anxiety disorders. That also according to the World Health Organization. And suicide rates are really high. And like you can see, like 30,314 cases reported in 2016 from India related to the suicides related issues. And Bangladesh, as you all know, like these days the situation in Bangladesh, so the students are like they are facing a really they are going through such severe mental health issues for about because of their education system. And as you can see, it's a 16.1 of adults experience mental health issues in Bangladesh, but less than 10% seek professional help. So in Indonesia, it's 6.1 of the population experiences depression, and mental health services are scarce, and with only 0.015 psychiatrists per 10,000 people, which means they are lacking of psychiatrists in Indonesia. So that is a very big problem. So which means they don't have, so some places they are afraid to go to psychiatrists, and because of the stigma and all. And in Indonesia it's different, they don't have actually psychiatrists. So in order to get what do you call the access for mental health and related issues, and in Thailand, approximately 1.5 million people suffer from depression. That also, according to the Department of Mental Health in Thailand, 2020. So stigma remains a significant barrier to accessing care. So sometimes people thinks that, like it's a very general concern that people think, okay, if I go to consult what do you call a psychiatry, so if I go to a doctor, these people will think I'm mad or I should go to the mental hospital. No, it's not like that. So we all in our life, at once in a time we go through a depression. So for that time, we should not prevent of taking access, taking care of ourselves. So it's definitely we should go to see a psychiatrist, or we should go and talk to a doctor in order to get treatment. So in China, 54 million people suffer from depression. That is also according to a China mental health survey, which took place in 2019. And only 15% of those with mental health conditions seeks treatment. That is also because of the stigma. And in Japan, suicide rate is 16.5 10,000, sorry, 400,000 individuals, one of the highest in the developed world. That is because Japan is one of the biggest developed country, but still they are going through mental health issues, and suicide rates is really high, and high prevalence of hikomari, uh, affecting around 5,41,000 people. So these are the statistics of in the Asia Pacific region. All right, so these are some general statistics, which is according to the U.S. Department of Health and Human Service Office of Minority Health, African Americans are 20% more likely to experience serious mental health problems than the general population. So now we are moving to the impact of social determinants. Uh, so social determinants mean like uh, the health conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Which means now it can be like sometimes people face and people have mental health issues according to the environment situation. Like you can see the examples, the communities they are born, the way they live, and how they learn things, and about because of their work, and because of their cultural beliefs, their religions, their worship backgrounds, and their age. So because of that, the people can face mental health issues, and they might go through depression. So that's what means social determinants of health. And so we can actually how these determinants affects minority mental health. So it's the same thing, like we always have the lack of access for quality education, and like people, they don't have the common general knowledge about the things, and like we can bully someone about because of their race, religion, their cultural belief, and about this because of this fact. So because of these things, people go through the severe depression. So that's why the quality education is very important in order to minimize this kind of actually these are not these mental health issues are not necessary, like, and it will actually, it won't be exist if we have like a good education system in our schools, in our curriculum, in our schools. So this is the only way that we can eliminate the social determinants of health, these effects of social determinants. So, and when it comes to the barriers to mental health, common barriers in accessing mental health services for minorities. So for everyone, it's not only for the minorities, for every individual who go through the depression or any kind of mental health issue. So the barriers can be like lack of access to care. And as you can see, we saw the statistic. So in Indonesia, they don't have actually access to care because they are lacking the psychiatrists in the country itself. So lack of access to care and language barriers. So there was when I was looking the facts and figures, I saw in one place that these Native Americans, like this, they have still they have barriers for languages. So they are afraid to, because of that, like they are afraid to go to see a doctor. And for instance, according to the American Psychiatric Association, only 1 in 3 African Americans who need mental health care receives it. So that is because of the language barriers. They're afraid to go out of the wherever they live to get proper access and care. And when we come to strategies to overcome these barriers, strategies or initiatives that can help overcome these barriers are increasing awareness about mental health in minority communities and improving access to mental health. So if you can just chat in the box, like, like what are the strategies? So, like here we have given some very less, figures and things. If you have like, if you can give an examples like, okay, what are the strategies to overcome these barriers apart from what have mentioned here, just write in the chat box. And the strategies or initiative that can help overcome these barriers are increasing awareness about mental health in minority communities and improving access to mental health services. So basically, that is the only way we can overcome from these barriers of accessing the mental health support or receiving mental health support. That is initiate. That is, we can do only by increasing awareness about mental health, which means taking treatment or getting treatment is not a big thing. It is a very common situation. Like when we have flu or something, like we go to a doctor to see, get medicine. So it's something like the same, when we have, because these days in this generation, like most of the people go through mental health issues. So we should go, and once, as now you all can see that there is a big movement and big open and wide awareness programs are happening based on these mental health issues. So that is very important, and it's really good that we are helping to reduce, we are helping to reduce the stigma on mental health. So these are the barriers and strategies we can do to overcome from these barriers. So we are going to the culturally competent care. So what does that mean? The definition and importance of culturally competent care. So it's mean culturally competent care is ability of providers and organizations to effectively deliver health care services that meet the social, cultural, and linguistic needs of patients. So basically, first of all, like these organizations should understand their patients, or they should understand, what services we should give based on, like we have different categories, when it comes to, because we can't give like the same treatment or same advisors or same thing to every person who are coming to you. Now, let's say if you're okay, if you are a psychiatrist, if you are a mental health service provider, so you might get hundreds of people coming to you. So you can't give like the same solution, same thing. You can't talk the same thing with every person. So it has to be different person to person according to their social stigma, or it's based on their cultural issues. So likewise, we have to understand the patient, and then according to the patient, we have to give them whatever the treatment or whatever the mental health services, everything. So that's mean the culturally competent care. So it's very important, to maintain this, because its culture is a very sensitive thing. So we have to, it's not, because if we say something, being a psychiatrist or being a mental health service provider or advocate or a mental health awareness person or a volunteer or someone, if we like, okay, if we don't know about these cultural facts and the social facts, it's going to be because it's a very sensitive thing, because people can get sensitive, and if we say something wrong to them. So that is why the culturally competent care is very important, and how culturally competent care can improve minority health, mental health. And you can see culturally competent care can lead to improved mental health outcomes for minority groups, helping in building trust and improving communication between healthcare providers and patients. So that's what I mentioned. If we ever become like, let's say, or okay, we are like doctor or advocate and a mental health trainer or a psychiatrist, it's very important to build trust among the communities. So that's what, if that person is, but like we can see some people, some in, for an example, in Sri Lanka, it has happened, multiple times, and we did, we took actions, for those, what do you call, those service providers, that's they are doing something really wrong. They are making people mental health very worst by doing all these things. So actually I was one of the person who took actions on them, and actually they ask them to stop, and they call them to for these legal entities. They ask the human rights commission, ask them to come to the human rights commission because they are doing something wrong. So that's why it's very important. That's why we should build that trust, build that communication between the we can't call them like a patient, or it can be kind of like someone individual. So if that person comes to you or us, or if that person goes to anyone who in order to get any kind of some relief, we have to give them relief. We should not make it worse. So that's why the culturally competent care is important. And you can see steps to implement culturally competent care in mental health services. In the third segment, that is mental health services can take to implement culturally competent care by providing training healthcare providers on cultural competence. So as I mentioned, so if we it's not enough if we get the basic, what are the knowledge of the whatever the mental health services or the education. So we have to collect the basic common sense as well when we are providing the mental health services to others. So that's why the culturally competent care training is very important, so that we don't make people mental health issues more worse. And that's why we should implement training for mental health services providers or advocates or whoever willing to work on mental health and well-being uh, environment in future. Advocacy and policy change. So the role of advocacy in improving minority mental health. Advocacy can help in raising awareness about the unique mental health needs of minority groups and in influencing policy changes. So I know that after this, the new generation has like lots of new way of doing things, and it's really important. And because we know that we can understand people, comparing to, because now we have everything on internet, we have AI, we have everything, we have access to everything like never before. We can get all the information like very quickly. So it is very important to gain our knowledge by using these all the platforms to raise the awareness of it's not only minority mental health. It can be like we can take like common common people of who is facing the mental health problems. So it's not really related to minority mental health. It can be any person who goes through mental health and well-being issues. So that's why we should learn the unique mental health needs of minority groups. It's because we can search about the minority groups and what kind of the uh, issues they are going through, and according to that, we can work with this minority community. And current policies impacting minority mental health. Policies are impacting minority mental health both positively and negatively. For example, policies related to health insurance and access to mental health services. So this means yes, as I mentioned, the impact that some policies can both positively and negatively impact on mental health services, because sometimes, let's say now, if we take a hospital, like, what do you call, they have they have a place to, get like the general uh care for mental health issues, but actually they don't have, like, if it comes to, we say, as an example, I can take a person who is positive in HIV. Okay, so that person is going through the severe mental health and well-being condition at the moment. So, but there are some places, like, they don't have that access. They don't have a place to go and talk about their uh mental health condition. So because they don't have that knowledge, so these are really important. And so when it comes to policies, and what do you call, so sometimes actually there are no specific policies for mental health. So in the curriculum, let's say it's a government, they don't have actually, but people like us, people like organizations, we are reaching them to implement the policies and everything, but because actually they don't have a proper policies in order to give a proper access for mental health. So that's why policies impacting, that's how, and that's why the policies are impacting the minority mental health. As I said, it can be everyone, not only minority mental health. A person who go through the severe mental health and well-being problem, they all can get affected because of the lack of and the very poor policies and government rules and regulations. Actually, we don't see like that much policies and uh, government rules and regulations on the mental health issues. Actually, we are the people who doing that. We even though we always tell about, like, do this, do that, implement this policy, change this policy, but it never happened. But we are doing a really great job as mental health advocates, because we are giving that opportunity for people, which a government can't give. And the recommendations for policy changes to improve minority mental health. Policy changes can improve minority mental health, such as policies aimed at improving access to mental health services for minority groups. So I have mentioned about this as well, because it means, like, we don't have, we can't see any policies changes and things in these things, but actually we as mental health advocates, we do that, which is, at least we hope, like, by seeing us, the way we seeing the way we do things, in order to, what do you call, increase the access for mental health. uh, at least after they see us, okay, these things we should do as well. At least people, the governments and the whoever the people, responsible people will start actually acting on these policies and changes in mental health issues. So So that's all from my side. So I just go through a rough recap. So as you can see, like, the minority mental. So the if you like ever, if you forget that, okay, who's falling under minority groups, like, it's always, people who are differently able people and refugees, immigrants, the LGBTQ people, and the other, the people who don't have the privilege to get what, so base you can keep it like it is, this is, as this. So generally the minority people mean who don't have that privilege to get, or to get things as the general individuals, like, they have to struggle to get services and things. So you can keep it as this. If you don't remember who falls under the minority groups, you can keep it as that, the people who doesn't have that privilege to get the services and things. All right, so then stay active. So we have this thing: practice deep breathing, engage in physical activities, talk about your feelings, and spend time doing things you enjoy. And then you can maintain a positive, mental health, and you can increase your well-being by doing what you love and what you like to do. So thank you so much. And if you have any question, you can reach out. Uh, Jamyam, it's over to you.
Okay, so thank you, Ram, for your amazing presentation, and thank you for the participants for joining this session. So we will get back to you for the month of August very soon. So I hope to see you, everyone, like again. So yeah, thank you so much, everyone, for joining. So that will be it. Situ, do you have anything to add on it?
Hello. No. Okay. So thank you, Ram, and thank you for the whole team, Jamyang, Adarsh, for leading the session. And yes, today's session was so much important because we always talk about this minorities, but you know, many of us might not know about it. So from today's session, I'm very sure that how many people we are here today. I know that we aren't many, but from this participation, we'll be able to share the information that Ram has shared today. And it's a very important topic because this is always neglected, as Ram said. So, thank you, Ram, once again for being such a great facilitator, for sharing such an important subject, as well as everyone for your active participation. And every month we'll come up with new topic connecting with mental health and well-being for education to all. So thank you, Ram, once again, and thank you to the team, Jamyang, Adarsh, and to the participants. Thank you. Over to you, Jamyang.
Okay, thank you, guys. So that will be it. I think this will be the end of the session. So thank you, everyone. So before we end the meeting, I think, Ram, there is a message for you. Hello, Ram. I think you participated some useful seminar last month. Please tell us the most important points about mental health if you are discussing. Okay, so I think Ram left the chat. So I think this will be it for this session. Thank you, everyone, for joining. I'm going to end the call now.